So welcome. Today we're going to be videotaping one of our consults here for facial rejuvenation. This is a standard consult that we do here at our facility. I'd like to introduce Cindy Hamilton, who's our patient care coordinator, and I would like to introduce our friend Rebecca. Rebecca is new to our practice. She is interested in facial rejuvenation, and very graciously she has agreed to have this videotape today. So, Rebecca, welcome. Thank you for coming.
Thank you.
Welcome to Ocean Drive Plastic Surgery. How are you today?
I'm great, thank you.
Good. Are you nervous?
Of course, a little bit.
Yeah. So this is just a gathering of friends. So what we're going to do today is we're going to talk about what you want to talk about. We're going to show you a bunch of photographs of before and after patients that we've treated in the past.
Okay.
We're going to make sure as best as possible that we answer all of your questions. The goal of this really is just to get you all the information and let you make an informed decision. So.
Perfect.
Good. We're also not going to take photographs today. We only take pictures if we go to surgery. So your privacy is very, very important to us, and we don't want to invade it unnecessarily or by accident by taking pictures we don't need. So, what's bothering you?
Well, my biggest problem that I have, well, there's really two problems.
Okay.
The first problem is all the excess skin that I have here. And this has always been in my family, will always be in my family, so I would like to get rid of it.
Okay.
Okay, so that is the first problem. The second problem is I'm so sick of people saying to me that I look tired in the morning. And it's my eyes, and I know it is. And so I'm here today to see what I can have done that will help, you know, bring a little bit of youth back in here and take away that tiredness.
Sure. Well, that's actually a very common complaint, both of those. So traditionally speaking, people usually don't come in with an absolute diagnosis. They just have a sense that they don't look the same way that they feel.
Oh,
and the tired thing is something that Cindy and I hear quite frequently. So the goal of any facial surgical intervention or non-surgical intervention is to identify your natural inherent strengths and either enhance those or minimize weaknesses that take away from your strengths. So if you don't mind, if you look at the camera real fast, you can clearly see that the strength of your face lies right here. You have beautiful, beautiful eyes, really nice eyes, and really nice upper eyelids, and they're very bright. And on top of that, you're very engaging. And the other thing is laterally you have excellent cheek mass, very, very good cheek mass. And if you look straight at me one more time, I love your lips. You have a really nice Cupid's bow. It comes up, down, up, down. You'll notice your lip should make a little W. Shouldn't be overstated or understated, but it's got great volume, nice redness. I like it a great deal. So those are the strengths of your face as I see it. So the one thing that I like to do is once I kind of identify that, I look directly at your strength and then see what gazes away, what takes my gaze away from it. And the first thing that happens is these little lines right here. And number 2 is right here, and number 3 is right there. So, and these are always emotional issues, and they're always very personal. I don't say that, you know, lightly, but those are really kind of the things that I think are contributing to that sense of looking tired, or not feeling and looking the exact same. So, starting off from the bottom to the top, this right here, the neck. So most of this is skin. And some of this is fat, but the great news is I think the muscle that lives there, this muscle, which is called the platysma, I think for the most part it's in decent position, and most of the fall is just skin. So that can be remedied through doing something called a limited incision or lower third facelift. And that's an incision. There's a bunch of different incisions for it, but the incision I think that would work best in your case, instead of starting way up here, would be to start about right there, come back, go inside the ear, and then come back and stop right about there. And then underneath that incision, I'm going to raise what's called a SMAS, S-M-A-S flap, that it leads into this muscle, the platysma muscle. And we're going to basically lift up like that. And we're going to pull all of this skin back, and most importantly, pull that muscle back, tighten up that muscle. And then once we do that, whatever excess skin we'll take out under minimal tension, so that way you don't have a lot of scarring. But that's how we approach the neck. And then the other thing I think that would be helpful is some very light liposuction to that area. Just playing out a little bit of the excess fat that accumulates over time. That's not, you don't have that because you lived life poorly or because of bad nutrition. That's just a barnacle of life.
Okay.
You're actually in excellent shape. You look to be very close to your ideal body weight, so you've taken good care of yourself.
Well, thank you.
You're welcome. You're welcome. But that's a lower third facelift. It'll also reposition the jowl, and we'll do that through a SMAS flap. And we do what's called an extended SMAS flap. So we also, if you'll notice, there's a little bit of volume right there. We want to lift that up just a little bit. Just a little bit. Just maybe about 6 or 7 millimeters. And blend that a little bit more. You've got a little bit of volume loss right here. Again, I really like your lips. I really, really do.
Well, thank you.
You're welcome. But this volume loss here,
Yeah.
I think
Makes me look
sad
or frowning or
Right.
unhappy when there's not any feeling like that.
Oh, I can totally see it. Absolutely. So, because when you smile, it basically goes away because you deflect it up. So you have a couple of different options. Option number one is to use one of the commercially available fillers, and there's hyaluronic acid fillers like Restylane, Juvederm, Belotero. There's other ones called Radiesse, which is a calcium hydroxyapatite one. And then the third one that I like to use, actually, especially in conjunction with facelifting, is structural fat grafting, which is where I take fat from wherever you tell me to, and then I inject it into these areas and fill in these lines and volumize. And what that allows me really to do is sculpture. And that's the real difference between good and great, I think, when it comes to facial aesthetics. So the other benefit of fat grafting is it tends to last on the terms of years, whereas the other fillers tend to last on the terms of months to a year.
Okay.
So
Well, the fat sounds good.
yeah, that would be my recommendation. You do get some bruising and there is some swelling at the area, but that usually coincides with the same course of recovery from your facelift. So it works very nicely for patients undergoing facelift. The other area is right next to your nose. These little lines right here.
Yeah.
And more importantly, a little bit of volume to this cheek area, just to lift up the cheek just a little bit more. I would fat graft here, here, and here. And if you'd like your lips to be enhanced, I can, although...
I think they're okay.
Yeah, I like them.
That's the one thing that has been full.
Yeah.
So that's good.
I like your lips a lot, so I would advocate less is more, personally.
Yeah.
But
yeah. I'm happy with my lips.
that's up to you. Good.
Yeah.
And then the last thing is your lower eyelids. So that's a multifactorial issue. I think one thing is you've got a little bit of droopiness laterally to where the corner of the eye meets. That's called where the lateral canthus. And then you've got a little bit of fat that looks like it's poking out. And then you've got this line. This line here, that's called a tear trough or the lid cheek junction. And I think what's happening is you've just lost volume over time to that area, and that line's become more prominent. So it kind of extends just like this.
Okay.
Do you have you ever had any previous eyelid surgery?
None. Zero.
None. Okay. Do you have any problems with your eyes?
Well, I do have, dry eyes.
Dry eye. Okay.
Yes.
Are you being treated for that?
Yes, I take Restasis for it.
Okay. So dry eye can pose a problem with lower lid blepharoplasty. It's not an absolute contraindication, but we do want to proceed cautiously with that.
Okay.
So I'd like to at least have the opportunity to confer with your ophthalmologist and see where we're at. Let me, if everything's okay from that perspective, and I'm not saying that it is, but if it is, I think you'd be an excellent candidate for a combined internal-external approach to your lower eyelid, and instead of taking that fat out, repositioning it along that line and then tightening up the septum, I think would be the best thing to do.
Okay.
And then beyond that, I think you're absolutely near perfect. I know it sounds like I said a lot, and I don't mean to throw the kitchen sink at you, but I think that's an excellent result that can definitely get you a very nice, natural, refreshed result. Because again, I don't want to do anything to your upper eyelids. I think your upper eyelids look great. Botox is an option for your forehead if you're interested in removing those lines. You can get a little bit of a lateral brow lift, but your brow position looks excellent to me.
Okay.
But all things being equal, I think you have a beautiful face, and I think a limited incision facelift, SMAS flap, either lower lid blepharoplasty, if that's not safe, depending on your dry eye situation, we can always volumize that either with Restylane or with fat, and then fat grafting around the perioral area into the cheeks. I think that's a fabulous, nice, rejuvenated, natural result.
Okay, and the surgery length for having this all done?
So if we don't do a blepharoplasty, if we just do the facelift and fat grafting, usually that takes between 2 to 3 hours.
Okay.
We do not use a full anesthetic. We do not require that. So we use what's called a twilight level of anesthesia with some light sedation, very similar to like a colonoscopy.
Okay.
We only use a doctor anesthesiologist, okay? So there will be 2 doctors taking care of you, myself and the anesthesiologist. During surgery and after surgery, absolutely nobody touches you but me. I am responsible completely for your care from the beginning to the absolute end. You have direct access to me, and anything or any questions that you have, both me and my staff, we will absolutely bend over backwards to answer them to you. So our outcomes are obviously critically important for us, but as well, the process is really very important. We want you to feel comfortable with the process through the entire time. Cindy, do you have anything you'd like to add?
I just wanted to say, making the decision to have cosmetic surgery is a big decision, and it is a personal decision. And I know I speak for Dr. Durkin and our entire staff that we are all here to, make this a great experience for you. If you decide to, have surgery in our office, I will be glad to assist you with all your details, your paperwork and all your scheduling. And we're always here for you, and we're always a phone call away.
Okay, well that's nice to know, because you do end up having questions
Yes.
after the first day.
Absolutely.
So
Yeah.
appreciate that. Okay, and then as far as recovery time?
So from a limited incision facelift, we usually need about 10 days downtime. Now we do everything we can to cheat to minimize that. So all of our patients are put on vitamin supplementation preoperatively. We do believe in arnica, bromelain, high dose vitamin C, antioxidant therapy before we even consider having scalpel touch skin. After surgery, we offer 3 different options. Option number 1 is you can stay overnight with us. We have a private duty nurse stay with you. We have a private chef cater your meal. Option number 2 is my nurse will go home with you. And that usually works out best.
Okay.
You're not sick, and this operation isn't going to make you feel sick. We want to get you back into your natural rhythms as fast as possible, because we've definitely found that's
The best feeling?
absolutely. As soon as you get to sleep normally and you're eating regular food and you're surrounded by your loved ones, if we can do that 4 hours after this procedure, things go better.
Okay.
After surgery,
Perfect.
absolutely. It's a very organic approach. Everybody showers. There's no reason not to shower. We take off the dressings day 1. This is not, there is no significant wound care to take care of. After surgery, we do set you up with 2 lymphatic massages, and that's what helps us get down all of our swelling. And that's really crucially important. Really helps everybody just rejuvenate and quicken up the recovery process. And then between days 8 and 10, whatever depends on your schedule, sutures are removed, and we do a consultation with one of our estheticians, and we create a custom mineral-based makeup for your skin type. So almost everybody's out to dinner about day 10.
Okay, perfect.
If we elect to do your lower eyelids, then there may be a little extra swelling here.
Okay.
And that usually goes away 2 to 3 days later. But that's the only other X factor. And then that's a surgical approach. A non-surgical approach would be to do volume therapy, filler therapy to this area, and then to volumize a little bit in the cheeks. There's very little therapy that's non-surgical that's durable for the neck. There are modalities out there. We vetted them extensively. We just don't have the same faith in them that those company marketings currently have. But I think ultimately there will be technology available for the neck. We just don't have it right now. And then the other thing is volumization versus repositioning of this cheek. The reality is you did lose some volume, but you also had some descent. Over volumizing is not a solution. I think what you want to do is judicious volume with appropriate positioning. So I think in your specific case, surgical therapy is probably ideal with some volumization. I think if you volumize your face, you actually have a really nice triangle right now to your face. You're going to lose a little bit of that. So my recommendation would be a surgical approach, although about 70 to 80% of what we do is outside of the operating room here.
Yeah.
So.
Well, I anticipated this would at least have to be surgically, because I don't know of anybody that can really get rid of that. So.
Yeah.
Okay.
Anything else I can answer for you?
Well, not right now, but I appreciate that there will be somebody there to answer the questions for me, and appreciate your time today.
Absolutely. Last thing is the husband. husband is also our patient. So
Okay.
if he has any questions, please don't hesitate. Have him call us. Happy to speak to him. Happy to meet with him in person. Happy to do it however you would like.
Okay.
But you know, he or she, depending on who's getting the facelift, is important. The significant other. But please let us know if they have any questions. And I think what we'll do now is I'll have Cindy put together some price quotes for you, and we'll show you our facility.
Thank you.
Excellent.
Sounds good.